Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your metered dose inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. You should always sit upright or stand up when using your metered dose inhaler. Hold the inhaler in a vertical position to load and use it. Remove the cap from your inhaler. Hold the inhaler upright and shake it firmly 4 or 5 times. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Now you must breathe in slowly and deeply. As you start breathing in, press down on the canister to release a puff of medication. Continue to breathe in slowly and deeply for between 3 and 5 seconds, whilst keeping your lips sealed around the mouthpiece. Hold your breath and take the inhaler from your mouth, but continue holding your breath for 10 seconds or for as long as is comfortable. Now breathe out slowly. If your doctor has told you to take 2 puffs, wait for 30 seconds and then repeat the whole process again. It won't help if you take several puffs without waiting, and you must always firmly shake the inhaler 4 or 5 times between doses. Once finished, replace the cap on the inhaler to keep dust and moisture out. You can practice the technique in front of the mirror. You shouldn't see any mist coming from the inhaler or your mouth. If you do, make sure you're pressing down at the right time and that your lips are forming a really tight seal around the mouthpiece. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. Ask your local pharmacist for advice on how regularly you need to reorder your inhaler. If you're unsure about how to use your metered dose inhaler, speak to your GP, practice nurse or pharmacist for assistance.